This meeting is being recorded.
Here we go. Look, I got stools.
Okay. We're on record.
Okay.
Thank you.
Thank you. Oh, thank you so much.
All right, it's 6. Let's go. Hey, Mo.
Hey, Ricky. Live from the farm.
Live from the farm. We'll do it again. Live from the farm. It's Wednesday.
It's Wednesday night. Live from the farm.
Live from the farm. We'll do it again.
Live from the farm.
We gotta mute
It's
that.
Wednesday night.
Wednesday night. Hold on. Hold on. We're having like
Live
Zoom
from the
trouble
farm.
here.
Technical difficulties. There we go. We'll mute this one.
It's Wednesday night. Hold on. Hold on. We're having like Zoom trouble here.
Technical difficulties. There we go. We'll mute this one.
It's Wednesday night. Hold on. Hold on. We're having like Zoom trouble here.
Technical difficulties. There we go. Well, here we are.
Here we are at the farm.
It's true. And it is, in fact, Wednesday night, and the doctor is in. And we are so excited to see everybody. We're excited for you to see us in the same place at the same time. I mean, this is, there we go, tip it a little bit. This is incredible.
Right.
So
We're here at Mo's house together.
it's true.
I know we're not on Zoom.
For a totally different reason.
Right.
But we're just glad that you could join us and that you thought it not robbery on your Wednesday night to be here with us on the Doctors In on blackdoctor.org. So we are talking tonight about an issue that so many breasties face. You know, when I give a woman a diagnosis and tell her she's got breast cancer, there are lots of questions about the treatment. Am I going to need surgery? Am I going to need chemotherapy? Am I going to need radiation? What about my skin? And, you know, I tell Ricky, I said, when we have multiple solutions to a problem, when there's too many solutions, it means that none of them are really very good.
Right. And when you go to that grocery store or that drugstore and there's like 50 lotions and creams in this much space, what does that say?
It says that there's a challenge out there for women after radiation, and especially a challenge for women of color. You know, I can run down the list of things that I recommend for patients for their skin, but not everything works on everybody, and not everything works on every skin tone and every skin texture. So we are here talking to Karen. Karen's last name is Karen Lindsay of NIRAC, Natural Essence. And we're talking to Miss Shirley. How you doing, Miss Shirley?
Miss Shirley, can you hear us?
Your screen's a little bit
I'm
frozen.
fine. How are you?
Shirley Gilliam. So I met Karen.
Yes, I can.
You can hear us? Okay, great. And we have Breastie Nicole coming on too in a little bit. She's got stuck in traffic, but I met Karen at an LBC conference.
Wow.
And there was a really long line at Starbucks. I went to Starbucks in the morning. The meeting started at 8:00, so I didn't know her, but I could see that she had the badge on, the same badge I had on. So she was coming to start, and I was leaving. I said, "There's too much of a line here. We're not going to make it. Just come with me." And she did. I said, "There's got to be another Starbucks in Philadelphia within 3 blocks."
Yeah, you know there is.
And so she came with me. A stranger, but whatever. Like you can tell that story.
It's so cool that LBBC brings all these people together,
Right.
And we're actually out here at the farm for LBBC. But you know, Karen, tell us your story. Tell us about how you were diagnosed, your treatment, and give us some insight on how innovative. Like, how did this inspiration hit you?
Well, you know, my story started where I was in total denial because when I found the lump myself. And when I found my lump, you know, I went to the doctor and she said, I need you to go to the surgeon. And I like say, yeah, okay, or whatever. I waited 6 months and I don't recommend that to anyone. So when you find a lump, make sure you go to the doctor because then
that's another show coming in October called Waiting.
Yeah, you definitely need to do a show on that because there's so many people that do because we don't take it serious. You know, the lump was right under my armpit to the side of my breast. And I could feel it. It was a nice size. And I waited 6 months again, and they told me I ended up being diagnosed with stage 3, HER2 positive. And so when I was going through, I ended up doing chemo. I had accepted. I asked to participate in a trial. Again, thank you for doing all the work you're doing with the trial, because no one told me about a trial. It was from another breastie, and she said, you need to ask your doctor about a trial. So when I was going through radiation, my skin started to really burn and get breakage in the skin. And they told me to use Aquaphor. And the Aquaphor just wasn't working, because it's thick. And can you imagine putting something thick on a bruised breakage in your skin? And it just wasn't working. So I was in Whole Foods one day, and they had a health food book, and they had all these different oils in there, and they were talking about the skin. And so I started mixing these different oils, and that's how I came up with my product. And my doctor said, oh my gosh, your skin is really looking good. But it wasn't because of the Aquaphor. It was because of what I was, I mixed, there was the vitamin E, the aloe vera, and it was a more concentrated formula than versus what you would get over the counter, So then I started sharing it with my mother, because she was diagnosed. And then I shared it with Shirley, who's on the call with us. And I mixed up a formula, and her doctor was asking her, what are you using? Shirley had no breakage in her skin. She tanned a little bit. And so most of my customers that use the products from the beginning to end, the skin may turn a little dark, but their skin will not break because of the concentrate. I have an intestine formula that's very concentrated. So that's how I started my journey, because it was so painful. I wanted to make sure no one else experienced the pain that I went through, because I just wanted to stop radiation because it was so painful.
So painful. Wow, wow. Wow, wow.
And it really depends on a couple different things. How much radiation, right? Because the way doctors decide, and I guess this is a good teachable kind of point, is that they decide how much radiation you get based upon your diagnosis. So what size was your tumor? What are the margins? How many lymph nodes did you have involved? And that determines how much radiation and where you're going to get it. And what they do is they do some scans and a calculation. They say, okay, here's the maximum dose. Here's the dose you need. We can only give you this much per day. So here's how many days or how many treatments you're going to need. So everybody's radiation course could be a little bit different. And when were you diagnosed, Karen?
I was diagnosed. I'm going on 19 years now. I was diagnosed in 2003.
Yeah,
That's fantastic. 19 years ago, radiation was a lot longer and a lot different. And what we have learned over the years are that there's something called hypofractionation. We can cut it down. We can change the dose a little bit. And so, women are still having these same challenges, but there's no one good solution for it. And I love that you said that, because people say, oh, it doesn't burn, it doesn't hurt. And for some people it doesn't, but the longer it is, radiation is X-rays. It's like going out in the sun and getting a suntan. And you might go out and get a tan, and you might not notice that you got a tan, but if you get a sunburn and you burn and you peel, that skin starts to come off, and it can hurt.
it hurts.
Yeah.
It hurts. Yeah,
And
hurts.
the long-term side effects of radiation, nobody
Right.
tells you that your breast is going to give off heat for like the next 6 months, right? You got like this heater going on, and you're like, why is this one cold and this one is hot, right? My skin feels different. It feels super sensitive, And so there's a lot that is left to be desired about that conversation. Because did your doctor tell you some of those things about skin sensitivity and the texture was going to change?
Well, they didn't talk to you about that. What they'll tell you is that we're not sure if your skin is going to react the same way as others. Skin is different. So they don't want to put you in a category, but they do tell you, they're referring you to the same type or formula to use.
Yeah.
Is the Aquaphor. And so I know there are other things out there now that are, the ingredients the formulations have improved a lot, but I have really stuck with what I use. I'm still using to this day. It's not just a radiation formula. It also helps with dermatitis,
Eczema. It works on eczema.
and sunburns. Yeah.
Right. Because the thing is, I think as people of color, we grew up knowing that we needed to moisturize. Right. I grew up, and my mother she would take Vaseline and slather it all over my face. Right. I would go out looking like I was getting ready to do 12 rounds with Mike Tyson, but not everybody has that same understanding about really what makes your skin moist versus what makes it shiny. also. And locking in that moisture is something that's really, really important when you are going through your radiation, because you can't just slather oil on and then get radiation. It's like putting on baby oil and getting a suntan.
Right.
Right.
And also Vaseline and Aquaphor, they're all petrolatum. What
Yeah.
is that?
Yeah, it's a lot of grease.
It's
oil.
gas. It's like gas,
Yeah.
right? It's like,
It's a derivative, but it's basically it's oil.
yeah.
And oil and radiation really don't
Don't mix.
mix. So it's a good tool to use after your shower if you want to lock in that moisture, but having something that has a bit more emollients in it that makes your skin soft, having something with some vitamins, having something with soothing
With
herbs,
aloe.
and with aloe, things like calendula or comfrey, those are all really great additives that help to protect your skin and put some nutrition back in your skin. Have you studied, since that time, have you been studying skin and what makes it what makes it tick and what makes it soft and smooth?
Yeah, I have. I started taking some formulation class with botanical formulations, and I've gotten several certificates with their taking their training and stuff. And I understand how the combination of the different oils work versus just giving someone vitamin E. So if you have vitamin E, flaxseed, and all those different, grapeseed oil. When you mix those two together, you have something great. It's just not because
Powerful.
Aquaphor is really thick, and you
Yeah.
need something that's going to penetrate deep down into your skin, that's going to heal your skin from the inside out. Not just something that's going to coat it, and that's the most important thing. That build your skin, the cells in your skins back up, and make sure they're alive again.
Mm-hmm.
So,
Right. Great.
Absolutely.
So Shirley, what's your story? How did you find Karen and how did she help you? And what's your story? What's your story?
Well, Karen and I had been friends prior to that, years prior to either she getting it or I'm getting breast cancer. But I was diagnosed in 2010 with triple negative, and I had chemo and radiation. And of course, when I told her I was going to have the radiation, she said, "Okay, I'll send you my lotion," and I used her lotion. They offered me the Aquaphor and the Eucerin, but I was using Karen's lotion, and like she said, it got a little tan, but I never burned at all. It was the best experience ever, if I had to say that. And then here, 11 years later, I now was diagnosed with breast cancer again in my right breast with triple positive. So I will start radiation again tomorrow. And again, I will use Karen's lotion.
Wow. So you start tomorrow. What stage is your triple positive? What stage is your triple positive, Shirley?
you're going out, Shirley.
We're losing her a little bit. We'll come back to her.
Mm-hmm.
We'll come back to her. You're probably the third person I've talked to in the last 2 weeks who had triple negative and it came back again as triple positive, like Dr. Lori.
What was
the thing,
And this is the tricky part about breast cancers, is that they find a way to mutate and to evade the pills, to evade the chemo, to evade everything. And so you have to focus on as best as you can, putting in those good nutrients, right? Like you were saying, Karen, making sure that you're healing from the inside out, because, even radiation itself has some long-term side effects that could include things like a secondary cancer in the skin. And so really protecting that skin is very, very important. And I just think that, we got to do a better job of educating people about it and about their options, because there are newer options for radiation now, even while you're in surgery. I had a talk yesterday with a company that does intraoperative radiation. Imagine if you could get the treatment that you needed while you're sleeping on the table and wake up and your radiation is done. And it's not for every cancer, right? It's for early stage breast cancers, but the technology is evolving. And I think the products and the conversation has to evolve with it, because, Karen, tell us about some of your testimonials and some of the things that you've seen and heard from friends, family, loved ones, from, people that you've encountered in your travels.
Well, I have some great testimonies. I've had a young lady, I was at the hospital to visit another young lady that had breast cancer in San Antonio. And the cancer had spread to her brain. And this young lady walked in there. She had all this energy, and she was really thin, and you could tell she had chemo, and she was talking about how much pain she was in. And I just happened to have another bottle, and she went in there, and she had something that the doctors had referred to her that she was using, and she went in there and into the restroom, and she put the lotion on her burned skin, and she just like, oh my God, she got instant relief. And she had a double mastectomy, and so she's one of my pictures on my testimony page, and her skin had burned so bad it was blistered, and it's just like the stuff that she was trying to use was just making it worse because it was so thick, and then with my mother, when she used it, her doctor called me in to meet her, and I met with her. She said, I don't know what you do. I don't know what kind of work you do. She said, but there's a lot of products out there, but I've never seen anything that works this well. Because again, her skin didn't break. She tanned a little bit, and she wasn't in any pain, And so I worked with her doctor a couple of years, and I also worked with over Doctor's Hospital with one of the doctors over there. I gave her samples, and she was giving them out to her patients.
Dr. Regina.
I love that.
Yeah.
That's awesome. And blessings to that person. We got somebody in the chat who said, they were just diagnosed and had their lumpectomy, and they're starting radiation on the 20th. And so we want to make people aware of the side effects, the short-term and long-term. We call them latent and long-term side effects of radiation, and skin changes in the texture, in the sensation, in the integrity of the skin, all change after radiation. So if you're just joining us, we're the doctors in Wednesday night here on blackdoctor.org, and we're talking about radiation changes. We're talking about the skin and how to protect the skin, and what women of color need to know in order to protect their skin during radiation.
I think one of the best things about Karen's products is they're all natural, and they're made by a Breastie. Hello, for Breasties, with Breasties, about Breasties, that's what we're all about. So I think that, the care that she took in making the product specifically targeted for this need versus like Aquaphor, you put that on a baby's butt, that's for everything. So I think what's special about this is that she curated this product and this formula based on her Black skin. Hello. So it's made for Black women that are dealing with breast cancer issues. I think that's something that I respect, because I want that drug with the bottle on with our name on it. This one has it. That she made this for Black skin, for Black women dealing with radiation. And so that's what makes it so effective. And I think she's tested the formula. And it also, this is just one of her products. She snuck up on me a few months ago and gave me some body scrub.
I love it.
And I'm like, what, you made body scrub? Like, what's up with that? You didn't tell me.
Oh my God.
And this stuff is like, oh my gosh, it's like putting rubbing butter into your skin. Oh. And then when you get out of the shower, you feel like, and I need some, Karen, I'm out. It's like, you just feel like, oh my gosh, it's like you have baby skin again.
Wow.
And so even after you're done with treatment, this stuff is like gold.
And when you talk about Black skin, our skin is different, right?
Yeah.
We have more melanocytes, right? Which is where the term melanin comes from. Everybody likes to say, oh, their melanin is popping, right? But what happens when the sun hits our skin, when radiation hits our skin, it activates those melanocytes, and they work overtime, and that makes our skin darker.
Right.
Sometimes we can see things like there's a pityriasis. We can have that chicken skin where you see the pores, because the melanocytes inside those pores, they're getting darker, and it concentrates the melanin. So our skin needs are different. And I think it's really important for us to understand how to protect our skin. So Karen, without giving too much proprietary information, can you tell us some of the things that's in some of your products, particularly for radiation? Because there's some more folks in the chat who are singing your praises.
Yeah, you got some testimonials here, babes.
We got some fans here. And tell us a little bit about what's in it and what makes it unique.
Well, I think what makes it unique is most of the ingredients that I use you can cook with. so I use grapeseed oil. I use aloe vera. I use, well, you wouldn't be aloe. You can also drink aloe vera, and I use aloe vera in it. And you have vitamin E, and I also use the vitamin E that you can take in turn. I just use the natural vitamin E as well. So I use those two combination of vitamin E's when I put in there.
Wow.
With the
Wow.
vitamin E you can take orally. So that's why it's very natural, and
You can eat it. You can eat it.
Right. Yeah, I put lavender in it. I use lavender, and then I have the unscented.
That's beautiful. Right.
Yeah.
And the lavender is very, very soothing. Absolutely.
Yeah. Somebody's asking, is it just for breasties after radiation? What about irritation for keloid or irritated scars from 3 years ago that are still a problem?
Well, it'll help soothe them out. The keloids, I had someone that come to me about keloids before, and because of the way the skin has risen, and it's like and Dr. Moore, you might could speak more to this than I can, our dermatologist, but the skin sits up, and it's like it has some kind of pus. I don't know what's in it, but the keloids are very hard. So it'll soothe it out, but it will not remove the keloids. But it will help with irritated skin. It will definitely help smooth your skin out. If you have sunburns, dermatitis, anything like that, it will help smooth it out. But one thing we also have to remember, and not just talking about my product because I know it's good, and I have a lot of good testimonies on it. And I want it in everyone's hands that's going through radiation. But the most important thing is to remember, when you're diagnosed with radiation, you need to change everything that you used before. You can't continue to use the harsh soaps and stuff that you bathe with, because your skin is already going to dry out from chemo because of the drug. And then the radiation is really going to make it very sensitive, irritated. So you're going to use a shower gel that's more natural, So it's just not about the lotion that you put on there to protect your skin and help heal your cells, but it's also about your everyday care.
I love that you brought that up, because there are skin changes, and I think doctors got to do a better job of talking to patients about the changes at every point, from surgery, right? When I look at a patient and I decide what surgery they're going to get and talk about how they're going to look and feel, I asked them, well, how do you scar? What do your scars look like? Do you have keloids? Have you had any reactions to sutures? Have you ever had stitches before? Let me see what that scar looks like. And I think that these are considerations that we don't always take into account, especially for people with Black and brown skin. But, understanding how that skin heals after surgery, right? The keloids, like you talked about, really is an overgrowth of collagen. So collagen is the stuff that we call it a cross-linker. It's like weaving the fibers together. It's almost like the stuff in loofah. If you were to go buy a loofah sponge, it's the cross hatches. Oh, wow. And when that stuff grows too much, it gets puffy. Just like if you go to the store and buy a loofah, right? How puffy that is, right? That's like the keloid scar. It cross-linked too fast, it grew too much, and now you've got this hard, puffy scar. And things that can help with that, for whoever's in the chat: injections, sometimes taping, when we do like silicone taping, silicone sheets, or even the taping for like athletic tape. When we tape those scars down early and stretch them out, sometimes we can see some relief from that. Steroid injections can also help. So, finding a plastic surgeon or a dermatologist who has experience with keloids is a hard thing to do. There's a couple in DC, and sometimes they're private and they don't take all insurances and things, but knowing how you scar is important. And then finding those products that really do, like you said, Karen, give you that moisture that sinks in, the oils and the natural things that will get into the tissues, and massaging early and often, and figuring out your skincare regimen during chemo and then during radiation, because I don't think we talk enough about skin changes during chemo. I remember when my mom went through chemotherapy, her skin got really, really dark. Her nails got dark. The nails start to fall off, right? And all these changes are happening, so talk to us about some foods that people should be eating and some things that they can do for their skin, even during chemotherapy. What kinds of changes should people be making?
And they should eat dark leafy green vegetables. That is so important. And the fruits, you have your oranges and your apples. That is, if you can juice. And I'm not one, I'm not a fan of juicing greens and vegetables together. I mean, fruits together. I'd rather do them separate, but I'd rather eat my vegetables and juice my fruit. But it's very important that you eat. Asparagus is really good. Asparagus is probably one of the number one vegetables. Your Brussels sprouts are great. Your broccoli is great. Your spinach is great. But you don't want to do too much spinach when you're doing chemo, because they don't want you to get too much vitamin A. So if you ate a lot of vegetables prior to your treatment, your chemo treatment, then it's okay. But if you didn't, they don't want you to start eating them. You know, when I was going through chemo, my doctor said, if you're taking vitamin C pills, extra vitamin C, do it 2 days prior to and do it 2 days after. You know, we don't want you to take anything prior to treatment and doing your treatment. So that was a good advice, you know. So when I started doing acupuncture, I wasn't getting sick anymore because the medicine for nausea didn't work.
Wow. You're getting so much love in the comments, Karen. And Nicole's coming in now. Thank you, Nicole, for stuck in traffic. And Nicole actually has some before and after pictures that are gonna blow your mind.
Karen, waiting for her to. Oh, hey, there we go. I see you, Shirley. You back in business too.
Oh, hey.
Beautiful smile. Your skin is gorgeous.
Yeah. Brenda Walston says hi, Karen, in the chat. There's Nicole. Hey, Nicole. How are you, honey?
How you doing?
I'm doing good. Sorry.
No worries. Traffic happened. So
look at all this. Look at all the.
I know. You see, we're together today.
Oh my gosh.
Okay.
Yes.
So Nicole, we're gonna jump right in on you, girl. Tell us your story, and then I have your pictures teed up so you can talk about them. But tell us your story. My another triple negative sister, Shirley.
Yes. So, can you hear me okay, Ricky?
Yeah, we're good.
Okay. So I had to go through radiation, and unfortunately my mass was on my left side. And the concern was what type of radiation to do. And my doctor elected that it'd probably be best to do the proton radiation. And the thing that I was told was this type of radiation is more targeted and it can cause some skin irritation. And that's kind of what I was given. And so I went with that. And I wasn't told like what to do beforehand. The only thing they said is try to stay away from vitamin E, oils, and try to make sure not to use like an aloe vera leaf because of bacteria, like cross-contamination. Like if I have a lesion or an infection, then don't use aloe vera. That's what I was told. And so I had to go through. I
tell my patients to use aloe plant,
right,
because it's antifungal, right? And because it's natural. Yeah, you should wash it, right, and cut it open. But there's so much. This is what I mean about not just misinformation, but mixed messaging, right? And there aren't clear guidelines and consensus about this. And this is why it's important for Black skincare professionals and Black healthcare professionals and for breasties to weigh in on what works. I didn't mean to cut you off, but I just had to say, my patients might be watching. I tell them, go get you an aloe plant.
For sure.
Right? And not only on your skin, but eat and drink it. Right. And it will help.
Everywhere.
Yeah. And the other thing I was told is try to avoid direct sunlight, of course, to the radiated areas and things like that. And but I wasn't giving a whole lot of guidance. And when she said small, like I may not small, but I may have some skin irritation, I didn't think to ask more questions about that, which I probably should have in hindsight. Like what type of skin irritation are you talking about? Because honestly, I ended up with burns. And so I went through about 23, 25 rounds of proton radiation. And my skin started to literally burn to where I was moved to True Beam, which is a different type of radiation. And that was a little bit calmer for my skin. But because already I had the significant burns, it was still painful. excruciating painful, because I literally felt like I got burned, ran through a fire. And so when I noticed my skin changing, it was literally, it started to get darker, kind of like red, like a sunburn. And then the hyperpigmentation started, it just got darker. And it was about 4 weeks in when I started to noticing the cracking of the skin. And I asked my radiation oncologist, and he was like, well, you know, put, what is that thick cream? I can't think of it right now, but it's like,
Bean.
say it again.
Silvadene.
Yeah.
Yep.
Yeah. And it feels like you're putting Vaseline on your skin. And so for me, it worked a little bit until actually my skin started to slough off, because then it was just kind of like this nasty, peeling, goopy, sticky mess. And then they switched me to silver sulfadiazine cream, which is white, and it goes on okay, because it feels like you're putting, I don't know, like a like a frosting on your skin. But the problem is, because my skin was actually sloughing off, it would dry to it, and then it would become horribly painful to clean that off. And so it was just really bad. So I think, like, literally, I was just didn't know what to do. So I know I contacted Ricky, and I was like, Ricky, I'm dying here, literally in excruciating pain. And she said, I got a fix for you. I know someone who can help you. And literally, that's when Karen came right in and told me about her products and sent them right away. She told me to start off with the severe burn cream, and apply that and use that. And I was told by my doctors that it was going to take months for my skin to heal, because I had so severe burns. I mean, it was everything that was in the radiation field was burned, even under my armpit. And I lost my skin all in that area. And so I started with the severe burn cream, and it really helped a lot. One, I liked it. It did not sting when I applied it. It was very thin, so I didn't feel like my clothes and stuff was sticking to my wounds, which was nice. And then also it just didn't irritate my skin at all. And it was very smooth. It had a wonderful scent. It wasn't like a very odorous-y type scent, but it really calmed the inflammation of my skin down. And I started to notice at first, the areas that were really raw and red and irritated started to calm down. And then after that, I went in to see my radiation oncologist. It was like 5 weeks post radiation, because when I first saw her, she was like, it's going to take months. So when I saw her back 5 weeks later, after using the Nuric severe burn lotion, she was amazed. She said, oh my goodness, this is amazing. I wasn't expecting for it to look like this that fast, but this is good. And then I told her, I said, well, I stopped using that cream, the silver sulfadiazine cream, and I started using a different product that a Breastie friend told me about, and this is the result. And so she was like, well, keep doing it, because it's helping your skin, and it is looking good. No infection, the redness was down. I just had the hyperpigmentation, and she told me that, you know, it's going to take some time even for that. But literally, not to be long-winded with this, it took a good 7 weeks after radiation and using the product, because after the severe burn cream, once the inflammation, everything went down and my skin was calm, then I went over to the other cream. I'm sorry if I don't remember the name, but it was the regular cream. And I was putting that on. I believe I was putting on about twice a day, to be honest. And yeah, like a 360. Some of the hyperpigmented areas started to already lighten up. The worst areas that were severely burned took a little bit the longest to heal, but literally by 7 weeks, you can really even tell a whole lot unless I pointed it out to you.
So
Wow.
Nicole, I have some of the pictures you sent me. I'm gonna try to
Yeah.
share them and maybe you can explain. And you guys, this is pretty graphic. So get ready for this. I'm gonna just put,
I'm taking a deep breath.
I'm gonna take a, yeah, so I'm gonna do, here's the first one. So that was.
Yeah, so that's when I started to use the Newark cream, the severe burns.
I'm gonna put one of the bad ones up, okay?
Yeah, the very first one is when my skin just turned like really black and dark and hyperpigmented, and then it started to just break open and my skin just started to slough off. So yeah, so that is really bad. That's when my skin began to really just kind of come off. And you can see under the armpit, it was, oh my gosh, that was the area where I was just screaming literally internally every time I had radiation, because it was just excruciating painful. It felt like literally my skin was ripping apart every time I had to raise my arm. And unfortunately, in radiation, you have to raise your arm and be like a mannequin. No, that's my baby, sorry.
So that looks, it hurts like hell. Oh my God.
It did, it really did. I mean, I was crying. I had to keep it clean. And literally, it's almost like being, burned, through a fire. You have this nasty wound that has to be kept clean. You have to keep it, moisturized. And every time my skin would peel off, I had to try to clean that off and get it off of the skin. So underneath, it doesn't breed bacteria. It was really painful. Yeah.
And then it turned to this, right? Hold on.
Yeah, that is 7 weeks after. Yeah, that is, and you can still see some of the hyperpigmentation on the neck area.
Neck, yeah.
And over here,
But definitely tons better. And around like the chest, stuff started to lighten up and blend out more. My skin started to look more smooth. But definitely before that, it was just, everything was red, raw, and no skin, if you can imagine that.
Karen, you're a miracle worker.
Yeah.
My goal is to try to prevent the skin from breaking. And because, like Dr. Mo was saying earlier, you don't know how much radiation treatment a person is receiving. And, you could be doing 30 weeks, is it 30 weeks? 30 treatments, I think.
30 treatments, right.
30 treatments versus someone else doing 16 or 28. You just don't know. So I try to create formulas that's going to help them, especially with Nicole's burn. I knew I had to make a more concentrated formula like I did with the young lady that I met at the hospital. Because
so you mean there's different concentrations of this, or you do special formulas?
Yes, I have an emollient it's more concentrated, and then I have the regular body formula, body lotion. And the body lotion is for someone that when you start off, you're just using it. But if you see that your skin is breaking, especially for women that have mastectomies, I would recommend the emollient to use that, and because it's more concentrated, because you don't have that tissue behind you. It's just like your skin is up against your ribs almost. So you're gonna, the burning will come faster, and after seeing Nicole's pictures, I just like it just takes
what it does?
You just never forget the pain.
Yes,
So,
yes, and it hits the muscle. So for women who've had mastectomies, especially if they have flat closure or if their implants are underneath their muscle, the radiation makes that muscle tight and tough, like jerky, right? And so there's a couple other things that come into play here. When we talk about the damage that radiation does, it's deliberate cell damage to break the DNA through, like we call it, it's like an oxidative reaction. And so we talk a lot about breath work. I know Valencia, our expert, our resident yoga expert is watching, right? But the breathing in, the oxygen,
Yeah.
right? So some people end up in hyperbaric oxygen, which is 100% O2, to try to get more blood flow to that area to promote wound healing. But by breathing deeply, taking deep breaths early and often, and focusing on that breathing, you can get more oxygen to those tissues, right? By doing massage, you can work out some of that scar tissue, and by stretching, and we don't talk enough about this too. So in conjunction with the skincare, there's some other things that we can be doing to help keep that skin soft, to keep that muscle from getting tight. And every time you raise your arm, it's like, oh, I can only raise it this far. But we got to focus on those things. And having an emollient, like what you're describing, helps people to be able to do that stretching, because now you're rubbing something in that makes that tissue softer, and it makes it easier to stretch out, like kneading a dough, or like, you know, like oiling leather almost, because that skin, let's be honest, it gets kind of leathery.
And another
And mine did. And I use the lotion still now, 10 years later, you know, I mean, well, you know, after because I didn't know Karen when I was sick, but it really does, because I feel like my skin is very tough where I had radiation over here, you know? And so I used to soften it up.
And you know, there's another thing to also remember, that where I had my incision at, the skin is still kind of tough, and it gets like a eczema around there. And so what I do is I take my body scrub, and I scrub it. I let one of I think it was Toya, the young lady that was down in New Orleans with us, and I let her feel it, and she saw how smooth it is. Now the darkness is still there, is where it's because where the incision is, but it's not that rough, tough skin. The skin is not really tough anymore.
Yeah.
So, and also women, you know, whatever they can do. I know there are some bras out there. They do not wear a bra during radiation. If you can get something that's more camisole that has the bra pad in it, because when you have the bra under here, the wires under there, that causes your skin to break even more. And a lot of the women that I come in contact, they have a hard time with the healing underneath the breast, especially the heavier breasted women, you know, and it's because your breast is not breathing. Then you have on a bra, and you shouldn't keep on a bra all day. You have to let your breast breathe, and you have to moisturize it more often under here, because you may have a tendency to sweat under the breast.
Yeah, that's a separate and a definite issue, is moisture, right? When there's a dark, moist area, you're at increased risk for fungal infections, right? Like yeast under there, and that yeast can be itchy. It can turn kind of red, or darker skin, it might not be red. It might just be like little raised bumps that almost look like hives, or it could be sort of plaque-like, like a psoriasis or something, you know? But when we get those types of things, you got to hit it early and often. You got to keep it dry, right? Washing several times a day, and making sure you wash your bras in really, really hot water, and things like Woolite will help to decrease some of that itching. Even at the nipple, some itching and sensitivity can happen that, you know, doctors don't always, again, talk to patients about. But that skin care, and, you know, when we put the scars under the breast, when you wear that bra, guess what? It digs in right underneath that, what we call the inframammary fold. So this is all really great information that I think, you know, women need to know. After surgery, I don't recommend wire bras. I recommend comfortable sports bras that open in the front, that are Velcro or zippers or snaps or something that you don't have to reach up and pull over your head. You want to be able to put it on like a vest, and then zip it up or snap it together, and then making sure that, like you said, let it breathe under there, take it off at night. And I do tell my patients post-op to sleep in a bra, right? But I give them an extra one to go home, you wash one and you wear one, and then you take it off, you wash underneath, make sure you dry that, and you can use cornstarch. You could put lamb's wool under there. Sometimes people will put cotton under there. There's different things to help keep you dry underneath the breast, but that moisture can be a real problem for radiation and for skin breakdown.
Yeah, I use the cornstarch. You're right. You can use the cornstarch. I mean, I don't have much here, but I still use the cornstarch.
But it works.
It works, yeah. And you know, Karen, you know my paddleboard, right? So the mosquitoes kick my butt in the morning, and our ankle. And so I said, you know, I've tried everything for mosquito bites. Your cream works.
Wow.
I just started doing that like a few weeks ago. And it really helps my mosquito bites. I've tried Benadryl, I've tried cortisone cream, all the stuff, and nothing works, but it works.
Tell us a little bit about the scrub, because there's
Yeah.
people watching who, maybe are just supporters and family members and loved ones, or they just happen to tune in to Black Doctor and they're like, wait, what is this, a scrub for my skin?
Right.
Tell us more about that.
Right.
Well, I started fooling around again and I experimenting. And so I use organic sugar. So I use the cane sugar and I use the brown sugar. And they both organic. And then I mix like 3 or 4 different oils. It's probably more than that. And I mix that in there. And I mix it until, I have tried it several times to get the ingredient just right. Because I want it to be, when you rinse your hand off, that you can see the oil of your body off. You can still see the oil, but it's not oily. And so it really leaves your skin really smooth. I use it like, I know you probably shouldn't, but I use it like every night, so they recommend that you use body scrub every other day or 3 times a week. But because it's organic sugar, and some people use salt. I don't use salt. I love the way the sugar feels with the combination of the oils as well.
It feels
That's
really
And I
good.
do add aloe vera in it. That's another secret. I add aloe vera in it.
I love
Not
that.
before.
That's awesome.
Yeah.
One of the other things that to think about. So if you're watching and you are getting ready to, or if you're newly diagnosed with cancer, maybe let's start there.
Right.
There's some questions you should be asking your doctor. There's some things you should be talking about, meaning, doctor, do you have any pictures of patients whose skin looks like mine? Right? What might my skin look like after radiation? What might my scars look like? Not just where's my scar going to be, but what is it going to look like? And your doctor should be asking you about how you scar and talking to you about scar formation. And the other thing is that when you're considering surgery, women who have large pendulous breasts tend to have worse radiation side effects.
Really?
And yes. And so that doctor should be talking to you about possible lifts or reductions, right? We call them mastopexies, where you lift the nipples and take some of the excess skin, or reducing the breast, because in doing so, if you get a lumpectomy and you get a breast reduction, one, you're more likely to exercise, right? You have less neck pain, less back pain. And your radiation side effects are likely to be a little less, because the heavier, the longer, the more pendulous, the more underneath you have, that's an area that likes to burn and peel and cause and can get infected. So we know that Black women aren't offered plastic surgery, reconstruction as often, but reconstruction is not always for mastectomies. It can be a breast reduction. And so your doctor should be talking to you about that as well. So if you're watching and you know somebody who's going through this journey, even if you already had your breast cancer and you had your lumpectomy, if you don't match, you are a candidate for symmetry procedures, and your doctor should be talking to you about it in survivorship as well.
And I don't match.
And let's be
Most
honest,
of us don't.
they're twins, but they're never identical to begin with.
Right.
Definitely not identical.
And after surgery, they're definitely not.
But to have a product that makes your skin feel soft and smooth, like you want to touch it again, because your body is foreign after this whole journey is over and done with. You're looking down and you're like, okay,
what is going on here?
What happened to me? I guess this is my new normal. It feels different. It looks different. And maybe I don't have any sensation at all. But to be able to touch that skin and feel how soft it is it's worth working towards. And it helps, I think, to build some confidence back after a cancer diagnosis. And that's something that I don't know if you realize you give that, but in addition to all of the therapeutic things that you do, giving women back a little bit of sense of self and making them feel good in their skin that's priceless.
And we're all putting lotion on every day anyway, right?
Hopefully.
And I think we should get into a habit of using lotion every day, because sometimes we jump out the shower and we don't, if we're rushing, we don't do it, and I mean your entire body. Right. And I use it for my entire body. I don't use anything else. And I can tell the difference in the lotions now, because it's more water-based than oil-based, and mine is more oil-based. And I tell people, do not put it on. If you're going out sunbathing, do not use my product in the sun, because they have too many oils in it.
Can we talk about sunscreen? Yeah. Talk about SPF, because I think Black folks think that, we got that good melanin, we don't need any sunscreen, but that's
not the case.
That's a myth.
Yeah.
Can I ask you, Dr. Mo, about that, right? What you just said. Is there anything medically too where, because Black people have more melanocytes, right? That makes our ability to be able to get darker and tan and things like that more than and white folks, or Caucasians. So with radiation, especially with proton, do you find that because of those that are more of either Hispanic or African American ethnicity, that we tend to burn a little bit faster or more because of that fact? Or
Ooh, it's a good question, and it's one that hasn't been widely studied,
Right.
especially as it relates to proton therapy, because a proton beam is a concentrated type of beam, right? And it's a very specific type of radiation that's delivered. It's not quite as global. And so it's really, really helpful for certain types of cancers and for certain areas where you don't want radiation just going
It's
everywhere.
more
or
targeted, it's
spraying.
more
It's
like
more
laser
targeted.
targeted, yeah.
Exactly, but it's also can be a higher beam because it's more targeted. It's not as spread out. And so I don't know of a lot of studies that are really looking at the effects on Black and brown skin. And I think it's something, again, that we need to be researching, and we need to be looking at, because the likelihood is that because we have more melanocytes, because our skin is, that there is a propensity to burn, to peel, and to have this, we call it desquamation, that layer sloughs off, right? But have we looked at it? Have we studied it? Not so much.
Here we go again with advancing the research for Black women. We don't know for Black women.
Yeah, so it definitely should be studied, you know?
Yeah, another study.
And circling back to the things about the sunscreen, it's the zincs, right? So we know zinc helps in wound healing. Zinc oxide is protective for our skin as well as, everybody else's skin. But we who have more melanocytes, we should certainly be looking into putting zinc in our skin, and that can come through a sunscreen. And we don't typically like it because it makes us look pale and ashy, but incorporating that into your daily regimen is just like
So
you
important.
moisturize, just like you exfoliate, putting on that sunscreen. Dermatologists will tell you, Black dermatologists especially, will tell you that's how to protect your skin. But can we talk about how hard it is to find a Black dermatologist?
Oh my gosh, right?
Yeah.
I don't know what's harder, an oncologist or a dermatologist,
They're
right?
equally less than
Equal,
2%.
Yeah. We have a question in the comments about, can you use it on your face? And are your products good for male and female skin?
Ooh, you've tested on men?
Yes. They're excellent for male, but men don't like the lavender scent. So they usually buy the natural scented lotion, and they love it because, they definitely need it. But it works wonders. And
Right.
you can use it on your face, but I would use the regular form. I wouldn't use the emollient on it because it's more concentrated, and you don't want anything clogging your pores up. So,
Mm-hmm.
and
But that's a great trial, a good trial that you could do also is looking at, because many men have to get radiation and they too have a lot of discomfort and chest tightness and pain. So I would say, in addition to testimonials, beginning to test some of these things, in small patient studies is going to be really, really important information, for men and for women, for Black skin, for brown skin, for Asian skin, for everybody, because the things you're describing can really help everybody's skin.
Right. So you guys, if you're in the DC area, Karen is going to be with us we're going to be exhibiting at the Urban League Convention, July 21st through 23rd. The third day, the 23rd, it's a community day. So anybody can come into the convention hall. We're going to be doing mammograms, and Karen's going to be there sampling her products and selling her products. So you can come meet her and talk to us. And, it's our part of our When We Trial on the Move movement. And you can come and see the products, meet Karen, try the products if you're in the DMV area.
I love it. And
So
Nicole,
come hang out.
we should ask that question. I challenge you to invite your radiation oncologist to do some institutional studies, right? It doesn't have to be across the United States and big industry trials, just your patients, right? How many Black women do you see? And can we maybe just look at this? Because that is very publishable research that women want to know and we should be asking about.
I had a patient tell me at Doctor's Hospital, she said, it's not that Black and white women don't burn the same, we just don't heal the same.
Right.
So, yeah.
Mm-hmm.
I think that there was a young lady, a good friend of mine, and we were in Florida, and she's very fair complected, and she was in the pool, like maybe about 5 hours, and her skin was really, really red. And, you know, just like Nicole was describing how your skin was going to slither off, well, that's what her skin looked like. And then when I saw her the next day, you know, she didn't have any burns. She didn't have sunburn, you know, how the redness, she didn't have any of that. And I'm like, what did you do? She said, I used your lotion. I'm like, oh, look, now I can tell people that it's good for sunburn.
Well, all right, absolutely.
It is. It's definitely good for sunburn and mosquito
this is
bites.
Beautiful.
Yeah.
Mosquito bites, sunburn,
Sunburn.
and really good for, again, working into your skin that stretching regimen, right? So in addition to making sure you moisturize that skin, making sure exfoliate that skin, begin to incorporate stretching exercises, because the long-term side effect of radiation is contracture. Everything gets tight. The
Right.
muscle gets tight, the skin gets tight, the nipple gets puckery, you know, and that means shoulder discomfort. It means tightness. It means pulling. It means decreased range of motion. When you go to lift and you can only get that far, your doctor should be sending you to early cancer rehab, physical therapy. You know, a couple weeks after surgery, you should be talking about, okay, what can I do? How far can I reach? And you don't want to do too much, right? Don't get too aggressive, especially if you have implant-based reconstruction. You got to follow your plastic surgeon's recommendations, but somebody should be talking to you about those things. So if you're watching and you're going through this cancer journey and nobody mentioned rehab, stretching, exercises, skincare, this is the stuff. Write it down, because these are the things that doctor's got their hand on the doorknob. They're walking out the door, you know, and I get it. We're busy. We're trying to treat your cancer, but we should be talking to you about these things as well.
Yeah.
And Dr. Mo, I just want to say quickly, if I can, what you just said, I'm dealing with that, and I was never told that. And so I ended up with frozen shoulder on both, but definitely on my left, I'm still dealing with that, and it is excruciating painful, on top of the decrease in range of motion and things like that. And then now the muscles are pinching on nerves and causing nerve pain. And so it is very important what you just said, the whole stretching and getting that worked out, because radiation does make everything, like you said, like jerky, and everything is tight and there is limited range. And so yeah, definitely encourage that. And then also what I'm doing, what I find is helpful, it does hurt, is myofascial massage. It is therapeutic massage. It's not hand and stone.
Yeah, talk about it. Tell us what that means.
Myofascial massage, the thing is, we have a lot of scar tissue, and because of radiation, that's also damaged tissue. And so everything being tight, you have to break that up. So stretching and doing either yoga, Pilates, whatever you do is great, but actually you may need a therapist who is trained, and it's more of a therapeutic massage, to go in and try to stretch that fascial tissue. Fascial tissue is your skin, to stretch it out and break up that scar tissue. Because if you don't, that is a lot of, it can attribute to all of the decreased range of motion, the pain, the nerve pain, things like that. And so that's something that I wasn't told until now. And I had radiation back in 2020. So it's something that is never too late, but it is something to, if you're going to go through all of this cancer treatment, you will, unfortunately, everybody's different, have different type of side effects. And it's unfortunate that there's not a constant plan of care in light of the treatments we go through. But, you know, to Dr. Mo's point, please ask, because when I was told you may have some skin irritation, that's as far as it went.
Right. Yeah, I don't even think I was told that 10 years ago, Nicole, that you're going to have any kind of irritation. Just deal with it.
It was just, you go from, it's like a factory or assembly line. You go here, you go there, go there.
You're done.
But then afterwards, you're like, well, wait a minute. Now what do I do? And it's harder to manage these things the further out it gets, you know, and this is why I say, start talking, you know, Miss Shirley, if you get ready to go through things, start stretching now.
Right.
Start doing that moisture and, you know, putting this stuff into your skin, use the cream now, and have a plan in place. You know, and Nicole, I hate that this is happening to you, and that because it is painful, because that scar tissue can set in. But
Right.
doing things like that myofascial release and
Right.
multimodal pain control with, I recommend sometimes CBD oils for my patients, arnica oil. You know, there's a lot of different things that can help to get you some anti-inflammatory relief and calm that inflammation down, in addition to NERAC, because, you know, clearly NERAC has some anti-inflammatory properties as well, but using that early and often is going to be a help. But now you got to marshal a lot of different resources that you didn't think you would have to marshal, but yoga, meditation, stretching, Pilates are great ways to start to incorporate some of that stretching into your daily regimen, even just in your shower with the steam and the heat, beginning to just reach and to push. Acupuncture, acupressure as well.
Which
can
Karen
help.
definitely believes in. Karen
Mhm.
believes in that as well. Yeah.
Yeah.
But Karen, thank you. You know,
Oh.
it takes a breastie to help a breastie, right?
Mhm.
Yeah.
Thank you for this. And I put the website in the comments, and we'll do a post on Facebook after the show on our Touch BBCA Facebook page to show your products, and people can find you and you know, get some relief.
Your
Get some
clients
relief.
are like all over this
Yeah, I know.
chat. I
They are,
gotta
like,
tell you,
blowing up.
great customer service. This product was the best. I
Oh,
use
yeah.
it on this. I use the
Right.
scrub and the lotion.
Right.
And I love to see it, because, you know, you hear about a lot of stuff,
Right.
but when you hear from people who say, you know what, I use
I
this
do.
and it works for me. Like that's the most powerful
it is.
testimonial that there is. So you know, if you're just joining in, this was the doctor's in, we're getting ready to log off, but you got to go, not just if you are a breastie, not just if you have cancer, but if you are interested in products that help your skin to feel smooth, soft, nourished, and moisturized, you know, and protected. There's some great things out there for you, and NERAC is one of those products.
For breastie, by breastie, with breasties, about breasties.
Oh,
I
made
love
with
it.
love.
Made with love.
Made
With
with
breastie love. Made with breastie love.
Wow.
So thank you, Shirley. Thank you, Nicole, for your horrible pictures and good pictures
Mhm.
and stories, you guys. Thank you for, you know, and for helping Karen illustrate the efficacy and awesomeness of her
Yeah.
product. So, and thanks for this.
And
Mhm.
Nicole, I'm just so thankful that I was able to help you, because I knew you was in a lot of pain. And I just, you know, I just get chills right to this day. And I'm glad you're doing better. It's like it's almost never any end to it, but you know,
Love it, love it.
my
love
heart
it.
goes out to you, huh?
Yep, and join us at the
Yeah,
DBCA
thank you.
Center. You can
Thank
meet
you.
You can meet Karen and try some product and hang out with us at July 21st, 22nd, 23rd.
Wow. And keep us posted, Nicole, on what's
Yeah.
working for you and tips and tricks. We want you to come back and let's talk about some of this scar formation and restricted range of motion. And let's see if we can help some other folks out, because lots of people are watching and they're many years after surgery and they think this is as good as it gets.
Yeah.
But there's hope.
And Shirley, we'll be with you during your treatment, girl. We'll be with
We're
you.
praying for you.
Yeah, praying for you, supporting you. So let us know what you need, okay?
All right, thank you.
We love you.
Well, this has been hopefully relatable and reliable, and it's definitely real.
Right?
Every Wednesday night, 6 p.m. on blackdoctor.org. We thank our sponsors.
Yeah, thank you, Amgen. Thank you, Genentech. Thank you, Hologic.
Wow.
Thank you, everybody that's helping us out with
Oh
home
my
and
God,
trial.
Hologic, really?
Yeah.
Thank you, Hologic.
Yeah.
Oh,
Yeah.
I love the
Yeah, their
mammogram equipment.
sponsorship. Yeah.
And we hope that you join us every Wednesday night here, where we're talking about all things best, all things breast.
All things best and breast.
The best of all things
Right,
breast,
breast.
right here on blackdoctor.org. The doctor is in.
The doctor's in.
Breastie love.
love. See you next week. Breastie love. See you next week. Bye.
Bye.